Ellen, very happy to have you with us today.
Thank you for having
You're
me here
Ellen
today.
Marshall, and you're the winner of or the recipient of the Helen Rodriguez Award this year at APHA 2018. Can you tell us a little bit about you, Ellen? What you do, where you're coming from?
I'm coming from a personal commitment to health for all for a long, long time. I've been able to work in policy, whether it was at the United States Senate or at the United States State Department, where I was so lucky to work also then with Helen Rodriguez Trias and learn so much from her that I could then apply to that work globally. And then I also worked with foundations globally on these same things, but then got to bring it all home to my community in Colorado to work to reduce unintended pregnancy, which is one key aspect of public health.
Fantastic, and I know this award is for somebody whose commitment at work is with vulnerable populations, with population needs. Who are those populations you're working with? Can you tell us about those groups of people?
Well, we really in Colorado worked a lot to identify who was not having access to care that wanted that care. And sometimes it was an income barrier that was keeping them from accessing. Sometimes it was language. Sometimes it was just it not being part of their lives to think about their own sexual health and well-being. So we did a lot of outreach and listening, as I keep driving home how important it is to listen to those that you are trying to connect with to then figure out how best to meet their needs.
Fantastic, and I think we're all very proud of your work. Now, this is the American Public Health Association. Do I understand correctly, you don't have a background in public health?
I do not. I call myself a public health imposter. I am deeply committed to the goals of public health and to what it means at its core. And I try and I'm a kind of get it done gal. So I learn from the professionals who have real expertise, and I try and help figure out how to turn some of that expertise into practice. So policy has been my background, and then that has grown very much into advocacy, whether it's at the policy level doing advocacy or advocating for others who are trying to accomplish something that they themselves may not know the best course to figure that out. I advocate alongside with them.
That is great. So if I understand correctly, then you don't have a background in public health, but you do public policy. And it sounds then for the public health, APHA, American Public Health Organization, policy is very much part of public health. So in reality then, you're a public health worker from what I understand.
So I'm not an imposter, I guess.
No, I don't think you are. Yeah.
Well, I appreciate the willingness of public health professionals to always share their expertise, so those of us that aren't as well educated and learned can put some of that into practice. That's been I guess my education has been on a continual basis by the willingness of others to share what they know with me to help then turn it into reality.
Well, congratulations for the
Thank
work
you.
you're doing.
Thank
you.
you.
From the audience that is listening to this interview, what would you like them to take away from this conversation?
I would like people to take away that as much as we all work and advocate toward public health, to always remind people that they're in charge of their own health and to take actions that they need to achieve that high level of health, and to continue to just talk about it with other people to help this all become a permanent part of people's brains, that they know that that's part of them in every way, shape, and form.
Thank you, but thank you for your work, and thank you for your example, and thank you for being an inspiration to many public health workers.
Thanks
Thank you
so
for
much.
being with us, Helen.